I was painting on A-frame and trestles, well set up. Probably 2 to 2.5 metres high. I fell down, so I had a compound fracture of the lower right leg, just above the ankle. And then I dislocated and broke my elbow. I think the surgeon said if I'd done one or the other it would have been okay, but instead of tearing stuff, I actually broke bones because of the dislocation. So the elbow was pretty damaged, as in severe. They've basically taken a skin surface from this here, and right in my groin, from the top here right down to my groin, they've cut, and I think they've taken some muscle tissue and they've combined it to what they call a flap, which sits on the wound. If you talk about well-being and your headspace, it was fantastic because my family could still come and see me. My family's from Innisfail, but it's an hour drive. If I had to go to Brisbane, I wouldn't have had that support. Look, I'm grateful. The situation could have been a lot worse. I could have lost my limb. I could be in a different city completely without any support. So I think in the end, if we spend a bit of money now, I think you save a lot of money later.
So Mr. Brunetto had a very severe accident at the end of October where he had a significant right elbow injury and he had a limb-threatening injury to his right lower limb. The initial stages were sort of essentially used on stabilising his foot because his foot was hanging off at 90 degrees to the leg. And once that was done, it became apparent that he had a very significant injury where he was missing some skin and the bone was severely injured as well. So our orthopaedic colleagues did a very good job of actually fixing the bone back together again in what was a severe injury, but where we were brought in was because we had to reconstruct the area to cover the actual metalwork that was used for the reconstruction, but also to cover the missing area of skin. And this is what's known as a free tissue transfer or a free flap, where you transfer a piece of tissue from one part of the body to another area of the body. And this usually has to be done with operating microscopes because the vessels can be quite small. So usually they're in the magnitude of say 1 to 2 millimeters, sometimes a little bit smaller or larger. And it can be quite complex if you have a very, a lot of trauma to the area. So that's why an operating microscope can make all the difference in terms of whether or not the actual transfer works, or whether you end up with a dead transfer and ultimately down the line you may end up with an amputation. We essentially have one operating microscope, but what we're looking for is another operating microscope to if you like, handle the increasing workload that is done by both plastic surgery and orthopaedic surgery departments, particularly for types of severe hand injuries, upper limb injuries, lower limb injuries, so young children. It allows us to perform a reconstruction, if you like, there and then, thereby saving time for the patient in terms of less anaesthetics, but also saving time and resources for the health department in hospitals, because you're able to do it there and then as opposed to having to facilitate a transfer, say down to Brisbane or some. So I would say that on average we're probably using it at least 2 to 3 times a week, and I only expect that to increase because we are facing essentially a relentless demand, both in terms of cancer work, in terms of trauma work, and it just means that we can actually do a better job for the patients. If it's there, it means we can use it, and it's much better. But where the new microscope comes into its own is where it has the ability to actually visualize in real time how the blood supply to the area that we're looking to transplant, how that actually works within that area, so we know for certain that the piece of tissue that we're transplanting actually has a good enough blood supply to reach out to all the edges and work in the manner that we want it to. Actually, what the Hospital Foundation does is phenomenal in terms of actually communicating to people the real need for this, and actually explaining as well what it is we use it for and how we can use it for the benefit of the patients and the wider community as well.